Joining me today, in 1 second, so everyone knows we're going to be doing an edit on this tonight, so this is going to be a bit casual, and then we'll clean it up for Facebook. So 1 second, there we go. Just making sure everyone is here. Great. Hi, I'm Brent Stafford, and welcome to a special edition of RegWatch. And joining me today is...
Maria Papaioannoy-Duic. Come on, Brent, you can't say that.
From Rights for Vapers. Hi, Maria.
Yeah. Hi, how's it going?
Very good. Thank you so much for joining us for our Last Stand Canada coverage. And, it's a pretty big deal. Things are not looking so good for the industry right now.
I think you're under positioning that for lack. I have no idea how to explain it, but no. On paper, things don't look good. On paper, we're looking at the fight of our lives, a flavor ban. I mean, let's take away that it will destroy businesses. It will destroy humans. It will take away access to one of the best inventions of the last century. This century. It was invented in this century. And all because of fear, all because of money, and all because of the continued marginalization of the people who smoke in this country. And it is absolutely disgusting. We have a fight on our hands, and we need everyone to speak up. We need everyone to have that courage and know that their voice matters. And we're going to do whatever it takes.
Well, and that's great. And we're going to hear a lot of that rah tonight, I hope, in midst of all of the bleak conversation we're going to have. Today is a special episode. As I said, we have Luke Marshall on for a tape segment. He's a vape shop owner in Ontario. And we have joining us live, which you're only going to see one at a time, is David Levesque from Digital Smoke Supplies. Hi, David.
Hi, guys.
Hi, David.
And we have Shai Bekman from DashVapes. Shai.
How's it going, guys? Pleasure to be on with
Shai.
you.
Good to have you on, too. So we really wanted to host a conversation here around flavor ban, around nicotine caps, around what Health Canada is doing. For years now, we've been covering this story, obviously, and we've always framed this larger kind of a war on vaping. Often that's been, the nonprofit groups we've been discussing. Always it's Bloomberg. But I think now it's very clear that Health Canada is executing its own war on vaping, and it's time to start to put that moniker on what the health regulator here in Canada is doing. Maria?
Okay.
Absolutely.
Again, you're too soft. Let's be honest. Health Canada has waged a war on Canadians. It has not waged a war on vaping. It's waged a war on human beings. We need to put a face on who they are affecting. Because when they refer to it as vaping, and if you read in the regulatory impact analysis statement, they said, yeah, businesses are going to lose some money, but don't worry, they're going to pick it up in cigarette sales. So obviously, but they didn't say that, yeah, Canadians might end up, reverting back to all the health benefits that they've felt since vaping. So, but that's okay. They'll die quicker. That's pretty much what they said. So I think really what we need to do is stop referring to this as a war on vaping. It's a war on people who choose vaping, because it's the people that Health Canada has waged a war on. It's human beings, it's Canadians, and it's their ability to access a product that helps them stay smoke-free. There we go. Sorry, got upset, but you know me.
Well, no, that's okay. And Shai, why don't we start off with you there on our Zoom panel? What do you think? Is it too strong to say that Health Canada is executing a war on vaping?
I don't think so. I think they're misinformed. They're undereducated on the subject, and they're introducing regulations and legislation that is frankly irresponsible. It's not thought out. It's rushed. It's obviously being puppeted by somebody above them, so they're just following what somebody else is telling them, and that's exactly what it is. It's a war against Canadians who choose vaping.
And how about you, David?
Yeah, I mean, war is definitely not a too soft of a word for it. We're taking away the rights for people to choose a less harmful, 95% less harmful product to deal with their nicotine addiction.
It is ludicrous that we're going down this road in Canada. I have an employee here from Iran, coming from Iran. He still can't believe it.
You mean that it's actually a bit more draconian here in Canada?
Yeah, pretty much. And his perspective, he's like, "This is, am I really in Canada? This is how they're treating people that are trying to quit their nicotine habit. I mean, it's crazy."
So let's just walk through how we got here. And Health Canada, both in the flavor ban, regulatory proposal, and also with the nicotine cap, outlines that starting back in 2015 with the HESA committee and the House Science Committee. Is that what it was? I can't remember the whole name.
The House of, something.
Yeah, the Health
Committee.
Right, it's the Health Committee.
Health and Science Committee. The
Right.
Health and Science Advisory Board.
That's right. Yeah,
Health and Science,
HESA is really the key thing here. And so starting from that, which is now 6 years ago, the government of Canada was taking steps all the way through its process for years, evaluating the efficacy of these products, whether or not they're safe to have them legal in Canada. And then, of course, the federal Liberal government, tabled legislation, albeit from the Senate. So maybe that's the problem for Mr. Trudeau. But the fact of the matter is that the government tabled this legislation working with Health Canada, and they passed it and made vaping legal. And that was just 3 years ago. And I just can't help but be stung by that it seems that like Health Canada never made it legal in the first place.
I think, oh my God, I have so many words on this. I think we're on our third tobacco control head. We're back to Sonia Johnson, but didn't we have two more? We had James and that other lady. I forget
Susie McDonald.
And Susie McDonald. We started with Susie McDonald. Sonia Johnson was second. So these are all people that are at the head. They're the people that pretty much take the brunt of what the health minister says, and here's your directive and go. We've gone through 3 in 3 years, in 4 years. I think they've just given up.
Given up.
I think they've given up. I think there are people in Health Canada that want to fight for people for harm reduction. But I think the people that want these laws to pass and I don't think they want us to go back to smoking. Like, I don't want to say that, but I think they want to exert their power and say, continue with the quit our way or else. And the or else is death. So I do believe somewhere in their moral positioning, and which is wrong because they are people, they are they're working for the government. They're private citizens working as regulators and policy advisors, that there's too many people near the top in middle management and higher up that just don't want people to quit smoking. They're very old school, old guard. We're talking about the last half of them, 1980s tobacco control. And they don't like the concept of something is working that they haven't created. Something is working that the traditional way doesn't work. What has happened? Smokers have found a way to quit smoking on their own. And we don't like that. And so what are we going to do? Quit our way and die. We found an opportunity. We found a valley. Let's jump on it. That's the way I see it.
So let me just walk through the audience here some key points about the industry. Now, I didn't have time to put this into a fancy slate, so we're just going to do it off of my Word document here. But of course, excuse me, when Bill S5 was first tabled, its main purpose, it was an act to regulate the manufacture, sale, labeling, and promotion of tobacco products and vaping products. That's key. Pull in the manufacture, sale, labeling, and promotion of vaping products and bring them into the legal market. The economic cost associated with tobacco use in Canada is estimated at $12.3 billion annually. That is a huge, massive number. The cost to Canada and Canadians in dollars for all the suffering, disease, and death of smoking. In 2016, domestic vaping substances, so just the e-liquid market, and all of this stuff is from Health Canada's regulatory statement on nicotine concentrations, which came out in December of last year. So in 2016, domestic vaping substances, the e-liquid market was valued at over $250 million, a lot of money. But by 2015, including the hardware, it's $1.36 billion. It's a massive market in Canada. There are 200 vaping liquid manufacturers in Canada. 15 to 20 of them are large distributors. 85 to 95% of vaping liquid sold in Canada is manufactured in Canada. So this is, Canadian product produced by Canadians for Canadians. There are three main categories of stores where vaping products are sold. You have your vape stores, your gas and convenience, and online. And in terms of where vaping products are purchased by Canadians, 49% of vaping products are produced in vape stores, are sold in vape stores. 30% in gas and convenience, and 21% in online. And there are 1,400 vape stores in the country. There's 27,240 gas and convenience stores. And there are 1,500 online vape retailers. So the largest part of this market is an adult market, that we know that, and it's also in vape stores. So, David, you service a lot of this business, right? Give us some scope in terms of its size and what the size of the business might look like in a year from now if the flavor ban goes through.
Well, I mean, the current size, you just went through the numbers. To try to figure out what it might look like in a year if a flavor ban goes through. All you got to do is look to Nova Scotia, where 50% of the stores close within 3 months of legislation going through. So, we were speaking about this a little bit earlier. I personally think that most vape shop will be closing, and it will be left for convenience stores to service customers. And obviously you see the numbers growing from 2016 to 2019, and a huge chunk of that has come from social acceptance and convenience stores having these outlets with the product from Imperial Tobacco and Altria with Juul and etc. So I would expect that portion to decrease drastically with people going back to smoking. But the vape shop section would probably disappear. The way they've written the laws that you have to create flavors with 40 molecules for tobacco and 42 for mint. No one knows to this date what that's going to taste like. But chances are it's going to be pretty horrible. So vape shop alone are not going to be able to, if you walk into a vape shop right now, there's hundreds of flavors, and they need those flavors to be able to keep their doors open. If you limit that to 3, 4, 5 SKUs, it's just not going to cut it.
If I could interject, I actually disagree with that a little bit. I think the vape shop channel is going to be, for the most part, okay. They're going to have their flavorless product, their tobacco, their mint and menthols. But what's going to happen is people are going to be purchasing flavors elsewhere. And that's going to create an unsafe market because people are going to be mixing in flavors that they're purchasing at Bog Barn that might be oil soluble instead of water soluble. And ta-da, you have another Avali. So Health Canada really missed the mark on this regulation because they should have let the nicotine ban, the nicotine cap, take effect for at least 12 months to see the effect that it has on youth vaping and youth uptake. And then they should have introduced further restrictions on products. Right now, what they're doing is they're going to create a massive black market that's going to be unsafe, and it's going to be impossible for them to regulate it.
I think they're okay with that, Shai. I think we're not giving them, when you're looking at this, all their data is collected from 2018 when it comes to the flavor profile. And when they said there that, there's 83% of liquid on the shelves will be affected, but that's from 2018. Think about between now and then, how many of our flavors have changed. They just don't care. They don't care if there's a black market. They've wiped their hands from this. No one's screaming, save the children to them. Then they can say, well, we did our best. We can't stop a black market.
I think it's going to be an unintended consequence of their actions. I don't think they're actively going about it to create a black market. But whoever is obviously pulling the strings, they're misinformed and they're uneducated about the subject that they're actually enforcing or trying to regulate, and it's going to create that unintended consequence. No different than Juul coming to market in 2016 created an unintended consequence of youth uptake because of high nicotine. So there's unintended consequences on both sides, but this one is going to be deadly.
I'm going to ask you a question because I love your press releases. Like, you know this. I've known you for how long?
Many years.
Like forever.
Yeah.
Many, many years. I don't know if anybody knows this, but back in 2013, Shai was my closest competition, 23 kilometers away in Toronto.
Yeah.
Which is insane. If you guys want to see, like, from 2013 to today, Shai, like, now I'm in Port Hope and my closest competition is 100 meters down the street. So, like, we've known each other for a long time. I respect and value your badassness. Totally. I love the way you're straight up. I love your press releases, and I love that you're consistent with the same questions. And I'm going to read those questions because I want to know if they have answered you. Mr. Bekman wants to know, what investigation did the government do in regards to the youth vaping crisis? How long was the investigation? What were the results of the investigation? How many people were charged? At what stage is the litigation? So, Shai, have you gotten an answer yet?
I'll give you one guess. Absolutely not. Nobody's reached out. Media hasn't reached out. Health Canada hasn't reached out. Nobody that is of any substance that could add to this conversation has reached out to give us answers on those questions, which I think as Canadians, we deserve to know the answers to those questions.
No, we deserve to know a lot of answers. And the thing is how are you curbing a youth market if you're not actually fining someone for selling products to a youth? There's been not a single fine federally.
Exactly.
So I'm like, I can't wait till the next one. Are you going to be able to tease us? Because the videos you guys have been doing have been absolutely amazing. I
do have, let me cue that up, Maria, and perfectly timed, because we've got that. So Shai, we just showed your press release you did on the on E-Valley, but tied with the nicotine concentrations, really, right?
It's asking them for answers to questions that they're regulating the industry based off of, but they don't have those answers. So they're just regulating us based on hypotheticals and anecdotes, pretty much, because they don't know the answers to those questions themselves.
And you came out with a follow-up release that was just actually late last month or early this month, I think, actually, and it was the proposed ban on vaping flavors, and here it is. And great, I agree with Maria. I mean, this is some strong material, and it takes a lot, to come out as a business. You're not a lobbying organization or anything like that, or an association, and you've come out with something that I think that strategically is pretty darn good. Your team produced this video, and Dave, who we've had on the show, Dave from DashVapes, and he's great. Let's take a listen.
We are in the midst of a youth vaping crisis. Here at Health Canada, we have a responsibility to ensure the safety of Canadians. It's time to shut off the lights on vaping. So, we have developed the world's first government-approved vaping cessation device. Introducing the cigarette. We are in the midst of a youth vaping crisis. Here at Health Canada, we have a responsibility to ensure the safety of Canadians. It's time to shut off the lights on vaping. So, we have developed the world's first government-approved vaping cessation device. Introducing the cigarette. To further talk about this breakthrough of a product, we have Canadian Health Minister Patty.
Patty, we're rolling. What? Hi, I'm Patty, and today I'm here to present to you the cigarette. As you can see, the cigarette, very compact, no more fumbling around for that silly vape, and the best part about it is, this cigarette is all organic. And why settle for vapor when you can have real smoke? Now, developing the cigarette was no easy task. We spent countless nights.
So that's a good little flavor, pardon the pun, flavor actually, but a good little taste of that. It was a very amusing video.
Oh my God.
It came out very well.
But the point though that's being made is pretty dramatic. And that is that it seems all too clearly that Health Canada is pushing Canadians back to cigarettes. They'd rather see Canadians smoke.
They say it in plain English. They say these regulations and these bans will cause people to go back to cigarettes, and they're perfectly fine with that.
Let's. I'm going to pull up. You've got a couple of quotes here in your release, which is very important. According to the Regulatory Analysis Impact Statement pertaining to the order amending Schedules 2 and 3 to the Tobacco and Vaping Products Act, Flavours, published in the Canada Gazette, Ottawa, Saturday, June 19th, 2021, states, and this is from the document in Health Canada, about 46% of current vapers, past 30-day use, aged 20 years old and older, are dual users, i.e. individuals who vape and smoke cigarettes. The total profit loss to the vaping industry that also manufactures tobacco products may be mitigated by the substitution of tobacco purchases from dual users who would go back to smoking and adults who smoke, who would continue to smoke instead of switching to tobacco or menthol flavored vaping products. After the proposal comes into force, it is anticipated that some dual users who currently use flavored vaping products would not substitute their purchases with tobacco and menthol flavored vaping products. They would choose to purchase more cigarettes, hence offsetting the loss of sales of tobacco and mint-flavored vaping products. So if you are a big tobacco company and you happen to have vaping products, and a lot of those happen to be flavored, you could be lucky the fact that you'll keep that customer. You'll just transition those that don't want to use the mint and menthol vapes. You can transition them over to Marlboros.
De Mauriers in Canada.
De Mauriers, yeah. Or Benson and Hedges or whatever.
It's disgusting. I don't even know. Public health is supposed to be for public health. Harm reduction is reducing the risk. One less cigarette is one less cigarette. Why should we marginalize smokers? Why should we take away a community that has helped people quit smoking? Because at the end of the day, Shai, he owns vape shops. David owns vape shops. But you know what they do own? They also own, in my opinion, a recovery center. They've helped people transition off of smoking. They've done the things that public health, pharmacies have failed for decades. And we did it not with all this medical knowledge behind us. We didn't go to psychology school, but at one point, almost everybody that works in a vape shop has smoked and they've had a hard time, or they've known someone and they're around it and they respect people and they help them. So Health Canada is, they think it's about the bottom dollar. And I think it is about money at times, but you can't put a price on. Shai, can you put a price on all the people who come up to you and say, thank you?
No. And I think that's the big part. A lot of people associate this with economic hardships, the flavor bans are going to put people out of business. They're going to put me out of business. They're going to put my employees out of work. It has nothing to do with that for me. All it has to do with is going to create an unsafe black market that my customers and people that I've helped quit smoking are going to be susceptible to. They're going to have increased harm because of bad regulation. That's what it comes down to.
I think the hardest part about all this, oh my God, I'm going to get emotional. I'm doing the Maria thing. I think the hardest part about all this is people don't realize that most vape shop owners care. Like, you gotta tell me one person who has been around people who feel joy and know that they feel better and have to hear day in and day out how much better their life is, how much more confidence they have, how many flights of stairs they can walk up, or how their lungs are better, or how like they're sleeping better at night, and tell me it's just about the money. It's about the lives that we're affecting when they're walking into the shop. And I don't think anyone understands that. And definitely, based on the quotes that Shai pulled, which are completely great, it shows that they think bottom line is how many people are going to go back to smoking and we'll make it back up in tobacco sales. I don't know. Do you sell cigarettes? Does anyone on this call sell cigarettes?
Nope.
Nope.
So let me just say that cigarettes are legal in Canada. And if you're in the business of selling cigarettes, more power to you. It's a legal product. It's just that vaping is a safer alternative. And as long as cigarettes are an available legal product in Canada, you would think that the health regulator would allow an alternative product to also exist. And that just seems to be what's maddening here.
Yeah, there's too much false moral panic, and that's exactly what it is. The regulators don't actually understand what they're regulating, so they're relying on other people to give them that information. But they're listening to the wrong side. They're listening to people that have a vested interest in vaping being less accessible.
Shai, you mentioned when we spoke earlier yesterday that the industry's gone through quite a bit of stages here in the last 2 years dealing with regulations from Health Canada because, of course, the industry is newly regulated. So there's all these steps and degrees, escalating degrees and stuff that they've been asking you to do. And I know that covering the industry has been doing it, not always happily, and definitely it's been very expensive. So walk us through all that you've had to do getting us to this point.
For sure. So several years ago, when they legalized vaping, they introduced CCCR compliance regulations for labeling. We had to go through, relabel all the products. Then, again, last year, they introduced another set of labeling regulations. Again, we had to go relabel all the products. Then they introduced a CRC regulation for childproofing. We had to dispose of tens of thousands of dollars of hardware that is no longer compliant. Then they introduced a nicotine cap with a 6-month or even less than that. I don't remember how long it even was, but a very short period of time for compliance. Again, you have to dispose of all those products. Now, if they introduce a flavor ban, again, very short period of time, you have to dispose of all those products. So the economic hardship on a business in any other industry would have already sunk it. In this industry, a lot of the businesses are resilient, and that's the only reason they're still alive.
And David, let's let Zoom here switch over to you. Are you there?
Yep.
Great, awesome. So you also have some similar concerns with all the stuff that has been required upon your business and others like yours in the country. Has it been like really millions of dollars, hit to the industry to comply?
Well, I mean, I can't talk for the entire industry, but I can definitely speak for ourselves. I mean, every year for the past 3 years, it's been tens of thousands of dollars in the garbage. Not even like just loss. It's garbage. And we're trying to be a green country, and we're trying to be proactive towards the environment. And then every year they put on new policies that really don't change much, whether you write nicotine one way or another, or, very little small details that make you change all of your inventory, and you have to toss all of this or toss the actual bottles, and you have to pay for people to dispose of it. So it's been it hasn't been easy, but in the end, we comply, we deal with this. Just going back to the conversation earlier, I do think that what Shai said about them being uneducated on the topic is the primary issue here, because when I was speaking with a health political advisor on Monday, and I mean, as knowledgeable as he was on one side of the topic, he had no clue of the other side. And the truth is that at a provincial level, there are many restrictions in Ontario and BC, which has had a nic cap for about a year now, and Nova Scotia full ban for about a year. They can analyze this data and make their decision based on that. But they've jumped the gun based on the 2017, 2018 numbers of youth uptake. And from, reacting from the pressure of all the anti-group, the health organization. And this is where we stand. But I mean, we're not going down without a fight. There was a campaign called Tobacco Kills that sent over 100,000 emails to MPs. Now there's another campaign to help people submit create their submission to Health Canada regarding CG1, the flavor ban. So they're going to keep hearing from us.
Now, this is a question I'm going to throw to everybody on the show. And as everyone can see, Maria is co-hosting here. So feel free to jump in more with questions, Maria.
No problem. I'm managing our chat.
Are you? That's excellent. But let me put one first to Shai, then to you, Maria, and then back to David. And it stems from what David was just talking about. And the larger issue here is that all of these steps, costly steps that have been taken by the industry based on compliance with Health Canada as they've been rolling out the regulations on this new industry, it seems to me that they haven't given any of the measures that they've asked the industry to take a chance to become effective. So let's just reinforce everything here. This comes down to youth use. So the whole thing here is the so-called epidemic of teen vaping. And that spike in use that happened in 2018 as a result in Canada of Juul legally coming onto the market just right after vaping became legal. And then, of course, the high nicotine content in Juul type devices. There's a couple other players in Canada too, but all big tobacco. And of course, what was happening in the US. So this youth use issue is really the biggest issue for Health Canada. And it seems to me, and I agree, that they've kind of thrown their hands up in the air and said, we just can't deal with this issue anymore. We have to basically, choke the industry off. But so my question to you then, first, Shai, is that did Health Canada not give all these measures a chance to become effective, or they kind of abandoned the process?
Yeah, the flavor ban was introduced before the nicotine cap was even in place. I've been a pretty strong proponent of the nicotine cap, thinking that nicotine should be capped at 20 milligrams, and I've talked to you and other people about why, but that step will single-handedly eliminate youth uptake. Kids that are experimenting will not be addicted anymore. They're just going to experiment, they're going to give up on it, and then they're going to go on with their lives. The nicotine at 59 milligrams off a Juul allows people to experiment, and then it causes an addiction to the product. So nicotine cap alone will completely obliterate youth uptake, and they're not giving it a chance to actually save the adult industry because they're just jumping the gun. They're just trigger happy.
And just for everybody that, everybody knows that's probably watching this show, is that the nicotine cap just went into effect last week, and they dropped the flavor ban last month. So clearly they didn't give it any chance. Maria, what are your thoughts on that? I mean, has Health Canada totally abandoned this market to the black market?
I think, yes, absolutely. Canada has totally abandoned this market to the black market. You can't make that any clearer. I think the fact is in the regulation process, we have gone to CG2 on every single regulation dropped, proposed regulation, except for relative risk statements. We're still waiting for the relative risk statements. So based on that, Health Canada has chosen to support any movement towards anti-vaping, because every regulation goes, if it's about making it harder for access. So we're going to talk about consumers. Access if this regulation is going to make this product look like it's bad, bad or as bad as smoking, that regulation is going to go through. Anything that is to help people understand the difference between vaping and smoking, even if it's on the Health Canada website, has not been regulated. And every single person that deals with, so as a shop, if my public health unit put up something that said vaping is as bad as smoking, me as a shop cannot fight that because I am not legally allowed to say anything. So what we're looking at is they're putting in regulations, they're swift, they're quick, and they're like very quick. Like today, I had my tobacco enforcement officer on a provincial level come in here and literally start looking at all my products. And this is the best, guys. Like, I swear I can't make this up. I was like awful to him, and I had every right to be because I was miserable. And I'm helping a customer, and she ordered 3 milligrams, and he told the customer I'm selling her an illegal product. So I'm like, it's 3 milligrams. He goes, anything over 20 is illegal. I said, it's 3 milligrams, not 3%. Like, does he think, first of all, that I'm at that point where I'm going to break a law in front of him? It's mind blowing. Like, they've given us, Shai, you said 6 months for the nic cap. We've known about it for 6 months. They gave us an extra 15 days. They gave us 30 days to comply. There is not a single product on the market that has had a 15-day window for compliance to remove inventory. That is how little that Health Canada is concerned. It doesn't forget about shops. Let's take shops out of the equation. Let's think about consumers who are addicted to 50 milligrams. They have not given them an opportunity to be able to wean down. They do not care about people. We got to take the consumer out of this right now and think about the people, because that's who Health Canada was hired for. That is what that is supposed to be there for. They haven't thought of, they don't have a plan. Where is their plan for everybody to help consumers? Oh, wait, there is a plan. Get Nicorette. So again, it is a pharma-funded plan. Sorry, I'm just like, oh. But they are making a mess. They're making a mountain out of a molehill. We have organ groups, or what do they call them? Oh, the
body part organizations.
The body part organizations who outwardly lie. They lie. We had a health promoter in Nova Scotia or New Brunswick say that e-liquid manufacturers purposely put something in the e-liquid to create combustion. I have no idea who the Jesus of our industry is that can turn water into fire, but good for them. But you lie. It's absolutely mind-blowing. So then there are no repercussions. However, if I'm at my shop and I tell you that vaping is 95% safer than smoking according to Public Health England, that's a $500,000 fine and 18 months in prison. That's my recommendation. So you know what? Can you picture me in prison, people? What are you in here for? Killing my husband. How about you? Oh, I told someone vaping's safer than smoking.
You just hurt my brain there. That image hurt my brain. David.
Me in prison?
Yeah, you in prison. David, I'd like to get a response from you too on that as well. In terms of Health Canada, have they abandoned the legal vaping industry and essentially abandoned it to the black market?
Well, I mean, it definitely looks that way. Look, it's very hard because emotionally, you look at this and there's such nonsense that it's hard to deal with. I'm hoping that they just have no clue. I'm hoping that, when you speak to MPs and elected officials, and I've spoken to my fair share of them, they don't know what's going on. Health Canada is kind of running their own ship. Is it bureaucrats? Who's influencing them? I'm not sure. But, you have Freeland, the finance minister, that wants to tax vaping. So, somewhere in the government, somebody thinks that vaping is going to stick around. and they obviously have no clue that what the Health Canada is proposing is going to destroy the entire industry. So I hope that if we get communication through elected official and kind of really inform them that they can kind of see the clear light and the clear path, because these policies will be killing people, and you know, smokers, 1 out of 2 die from smoking. So I mean, it can't go on like this, and somebody at the government has got to stand up and say, hey, what are you guys doing? Is it Patty? I don't know. I don't know what she does. Does she only sign papers? Does she approve this? Does she, you know, is she a pawn? I have no clue. But somebody in there obviously is working on this and has no clue what's going on, the impact of this. You know, I was talking to the advisor again, and I was telling him in the UK, behind the bus ticket, Cancer Research UK is promoting vaping. And over here, they're flat out lying, as Maria said, and making attacking us, I would say, I don't know, 25 times more than they're attacking tobacco now. So, but we're you know, we're there to help. So, I mean, if somebody looks at the real numbers, you know, somebody smart, let's just put it that way, the impact, financial impact of smoking on our country, and how much we would save if everybody would switch to vaping, and how much, you know, I mean, it's very simple. It's very simple mathematics. So the youth uptake, you got to deal with it. You've done it twice, and you haven't given it a chance to see the results. Now, there's results in other provinces. Go take a look. And then let's sit down and review those numbers. But obviously, you know, bureaucrats, it's hard to tell.
And it seems that, you know, it seems that the activist side of government is listening to the real activists out there that are stuck in using the old numbers. And it's not just the older numbers on the epidemic. I mean, we know that teen vaping has been seriously going down over the last 18 months. And they don't really use that good picture. It seems everything's stuck in that 2018, 2019 mode. And then, of course, we had EVALI hit too as well. And that's frozen in time on February 20th, 2020, when the CDC completely stopped recording any instances of EVALI because there wasn't a scare anymore.
But one number that's not changing, Brent, is the number of death linked to tobacco usage. That number is not going down. You're talking about over 100 people every day dying from tobacco usage in Canada. So, as I said, those policies will maintain these numbers and most likely increase them, because the 4 million, what is it, 1 million vapors in Canada?
1.25 according to consumers, David Clements, 1.25.
So how many of those will go back to smoking, or how many of those will go to the black market and make their own flavors and deal with vaping oil-based flavoring?
Like,
and you know, sorry to interrupt, Maria, but to David's point, the problem isn't the DIY market where they're purchasing flavors that a vape shop sources or a flavor house sources that are known to not be oil soluble. They're water soluble products. They're not going to cause issues for you. And then they're going to have to go to an alternative market to get those same flavors. But now that person is not knowledgeable enough to know whether a flavor is oil soluble or water soluble, and you get another EVALI situation. So the problem is a lot deeper than just a flavor ban or a nicotine cap or you know, labeling issues. It's legitimately the main issue here is the safety of the product goes down when you ban these flavors, because there's a market for flavors. People aren't going to just put up their hands and be like, oh, okay, flavors are banned, I'm going to move on with my life. No, they're going to try to source it in different ways. And the ways they're going to be sourcing it is a lot more harmful and has potential for a lot more damage than the current market if they just didn't touch it.
Yeah, no, that's
I work No, it's
Excuse me.
an actually very good point because I work front of the line and I've been talking to everybody about the flavor ban. And he's like, oh, that's fine. I'm just going to go to Shoppers Drug Mart and pick up those essential oils and throw it into my flavorless product. And I just about died. And even the same with these 50 with the nic cap. I've been telling everyone if they find over 20 milligrams come October, because let's be honest, like people are still going to sell it through their back door. There's going to be those people. We are not one of them. And I don't think anyone on this call is one of them. But I've been honest with my customers and I've said to them, if you have access to anything over 20 milligrams come October, think twice about what you're putting in your lungs. It is not coming from a reputable shop. It is not coming from a reputable manufacturer because not a single manufacturer is willing to take a $500,000 risk. That's the fine, is it not, Shai and David? Is it $500,000 if you produce the product?
I don't know exactly what the fine is, but it's high.
It's high. Okay, we've got some questions. Are you guys ready?
Born ready.
Okay. People want to know how can people in other countries help? Loaded question, but they want to do something. David, is there anything like?
Well, I would look. I mean, there's I'm having a hard time saying that word, so bear with me. I'm French, right? So constitutional. There's a constitutional challenge coming. So, I mean, if push comes to shove, we're going legal. There is, in Canada, we're lucky that we should be protected by the Charter of Right. So there is a GoFundMe right now, and maybe Brian can put the link later on, where people can donate. The target for this lawsuit, which is using one of the best firm in the country for Charter of Right legal cases, the target is 1.5 million. So right now, I think we're sitting at 126,000, but that's not true number because there's other contribution that I haven't showed up on there. But we're probably sitting at close to 700,000. But we need to get that 1.5, and we'll take them to court. The challenge there is that how long will it take, and how many vape shop and manufacturing companies can hold their ground while this is happening.
And I've got it up here right now. This is the one you're speaking about, correct, David?
Correct.
Right. So it's help us defend Canada's right to harm reduction. We'll throw this link up in the final posting of this video once we do our cleanup on both YouTube and Facebook. And it's being hosted by the Canadian Vaping Association.
I also just wanted to say is that the other thing people can do, just know that just because you're not Canadian doesn't mean that you can't contribute to the consultation process. You can go to saveflavors.ca and you can go there and create a submission. You just have to identify that you're not Canadian, but you are a supporter of maybe Canadian products, or you have friends who are Canadian, and put in your submission. The point is, our goal is to push the CG1 as far as possible. And one of the best ways, because it is a legal process, is they have to read and sort and file every single consultation. The other thing is share on Twitter. Share this video when the final product comes out. Follow Rights for Vapors, follow CVA, follow CDVQ, share our stuff, because you never know what your algorithm and what Canadian may see it. So it's really about, let's share this stuff. We need to get stuff going viral. And that's really big. And if you have the time and you have the heart, put your story on paper and send it over to Health Canada. Just find a little Canadian link to it, because we need as many people as possible. And also, a $5 donation is just as great as a $500,000 donation, because it's a donation and it is more support. And not only is the final number important, but Health Canada will be watching this and seeing that number there of supporters is equally as valuable. So if you say, I don't have enough money, just donate $5 if you can. If you can't, that's fine. But those are some other ways you can support Canadian. And like all our stuff on YouTube, so we can get better algorithms and stuff like that. I think that's about it. Like, I think that is really key stuff.
And that is key stuff. And then our plan here is to do the last little bit of the show talking about these programs. Excuse me. So why don't we take a moment? We have Luke Marshall, an interview that we did with him just yesterday, pre-taped and edited for us to watch right now. And it would be really important to kind of get his point of view in on this. And then when we come back, we'll talk in more depth about what can be done, because there's also a potential federal election coming up. I think it's not potential anymore. It looks like it's actually going to happen. And let's discuss how we can push the federal Liberals onto the side of vaping if possible, because it seems like they're the biggest stumbling block here. So anyhow, let's just quickly check out this short interview here with Luke Marshall. Is there about your shop? How long have you been in business? What's your clientele like?
We opened up my doors in 2018. And then back then, that was when I was on the main street right downtown here in Fergus. If the clientele is mostly, I mean, aside from the odd, teenager trying to get in, which they weren't allowed in, mostly 35 and up, I'd say, some late 20s, but mostly older folks my age.
So this is our last stand special here. Obviously, vaping is under a lot of pressure in Canada. Outside of your vape shop there in Ontario, I understand that you've got a wide experience with vaping shops across the country.
Yeah, so I mean, back in 2015, I was hired by Liquid E-Juice to be their sales rep to the various stores. So back then, there was a lot fewer shops than there was now. I sort of had some connection to the industry. I'd created a Facebook group, and so I knew some people, but I changed my whole career. I mean, I left I'm really well known in my career. I was well established. And it was funny. I was actually looking at 2 job offers going $100,000 a year or, $30,000 a year with a commission. And I went, well, this is my one opportunity to be in the industry that I really had grown quite passionate about. So I took the job and I never looked back. And it's been a lot of fun. And I got to call, every shop owner that I could find on the listing. And I got to know a lot of really great people, a lot of passionate people. People that were really had a spark, they had a spark that they were able to contribute something and maybe change what had previously been a life that they weren't happy with. And it was, not only did the vaping help them quit smoking, but it inspired them to help others quit smoking. And it's that spark was really what, it attracted me to the industry. I thought it's a great feeling to be a part of.
All the stuff that Health Canada has been doing is designed to thwart the youth use of vaping products. They just brought in the nicotine concentration cap. And then, of course, they announced, before that cap even came in, a national flavor ban. What are your thoughts towards Health Canada and the flavor ban?
Well, I think it's... I am not one of those people to subscribe to conspiracy theories, and nor will I ever pin that on them. But it gets really hard to see the willful ignorance, the denial of information, the quick turn away, and not think that something else is afoot. Now, I think that their research saying that the youth vaping is a big epidemic and a big problem was significantly overblown by the media, mostly coming out of the U.S. Canada has a habit of looking down there and thinking that's happening here, just because naturally the amount of content that there's generated. But the study themselves that they even quoted, I think it was even your interview with James Van Loon, where he said, David Hammond has a study that's not yet released. We know that, right? Well, since that interview had been released and then even been released because, I think you leaked it, actually. He wasn't doing it himself. And then he actually had to correct it, saying that there was no issue, right? And in the meantime, Stats Canada numbers had come out and said, the amount of smoking by youth from 12 to 17, it dropped to a number so low that they had that you couldn't statistically rely on it. So my opinion is basically, you're welcome. We didn't ask the industry. You guys have been trying for 50 years. We came along in a matter of 3 years. The smoking rate plummets just like that. There's something to be said there. And either, I don't know, either they're just so scared or they're just, I don't want to say corrupt, because there can't be that many of them that are that corrupt, because people are good people naturally, right? I think they're just scared. I don't know. But they're making all the wrong moves. Absolutely all the wrong moves.
What's going to happen to the industry if the flavor ban, gets implemented?
In Ontario, it'll be dead. I mean, in Ontario, we are highly regulated. So we're only allowed to sell vaping products. Like, that's it. I can't sell pop and chips. I can't sell anything other than vaping products, right? So, once people find their hardware, they'll stick with that for a while. And so I can sell them coils, which have very little margin on them, or I can sell them juice, right? So juice is a huge part of my business. It's how I make, that's how I pay my bills. So once that juice is, restricted to 2 or 3 flavors, it's just not going to happen. I'm not going to be in business anymore. That's just the way it is. That's why I've chosen to actually pivot. Well, I mean, first was COVID shut me down on the main street, so I wasn't going to let my customers go back to smoking. So they kept calling me, and so I said, okay, well, just come to the back door and I'll be there, and I'll make sure you get your juice. And then once it sort of became okay to open up again a little bit, I actually ended up opening a service window out the back. I cut a hole in the wall. That way the customers never had to come into my store. And I opened the store, and I moved my store back here, and I've actually elected to open an art gallery up where the store used to be, just because I knew that these regulations were coming, and I wanted to make sure that at least I have something, hopefully, to fall back on if that does happen.
So it entails for you at least the potential loss of your business, and if not, a total upending of it.
Yeah, it's gone. It'd be gone. There is no way to survive with these regulations coming. Not that I can see. No, I don't have the resources either. I'm not a very big chain. I'm a very small shop, right? So I don't have the resources to really get the newer. I mean, I just don't have that. I can't do much. I won't survive. I know that much.
So how does it make you feel knowing that the regulatory organization that brought all these businesses into a regulatory environment so quickly seems to be unwinding it, if not killing? Yeah, it's a little disappointing. A lot of it subscribes to the. I mean, I'm trying to get angry at it, and I mean, I used to get angry. I used to get really angry all the time, right? I used to feel a lot of passion, and quite frankly, now I'm tired. It hurts my soul to be angry all the time. I don't want to be angry at. I'm really proud of Canada for having a national healthcare system. I think it's one of the best in the world. I've never once felt unsafe there. I think I've had multiple surgeries, broken bones, and I'm grateful for the care and attention that I've received. And I really don't like the idea that I have to say, you don't know what you're doing, right? Like you don't know, because if you don't know this, that's so simple, that's right there. What else don't you know, right? And it makes it hard to really bridge that gap. And I think that's where a lot of people have trouble accepting vaping, because it does kind of mean that whole, if they're really doing this that badly, what else are they messing up, right? And I think that's where they're kind of digging their heels into, going, no, and they'll just deny the truth, right? And it's just not okay, right? Thankfully, we have the Public Health England, and we have, the Royal College of Physicians over in England, standing up and actually doing the right thing, despite the lack of a backbone that seems to be appearing here in Canada. Is Health Canada letting Canadians down?
100%. 100%. They've completely failed us. In this regard, as it comes to vaping, I think that they've become too much of a political entity. And I think it's already showing signs that it's starting to serve them poorly. Because, why do you think people are having trouble with the COVID vaccine? People see through these cracks, right? And there's a lot of vapors out there. There's a lot of people. Just for instance, their own impact analysis, Brent, the nicotine cap that was imposed on the 23rd, right? So they said themselves 125,000 people will return to smoking. That's what they expect. Now, if you look at the research that we know, like rock steady, we know for sure, half of people that smoke will lose at least 10 years of their life. We know this for sure. Like, that's a guaranteed practical fact, right? So you take that 125,000 number, that works out to 625,000 human years of life lost. 625,000 years of life. That's a huge amount of time that they've now removed from Canada, from Canadians, right? And so that part, that's just the nicotine cap. That's the one regulation that we thought we might be able to survive that, right? The flavors are just going to, I mean, you can triple, quadruple, I'd say even 10 times that number. That's 6,250,000 years of human life lost. For what? You know, what are they trying to protect? You know, they're leaving cigarettes on the shelves, right? So, and the funny thing is you go, I didn't smoke for the flavor. I didn't like the flavor, right? Why did I smoke? I smoked because I wanted to be taken seriously. I don't know. I smoked because it was fun. Who knows why I smoked? I smoked because I was a teenage boy who didn't have the capacity to understand long-term consequences, right? We know this, right? So what is this going to do for any of that? It's not going to change any of that. It's not going to change that smoking rate. What it's going to do is it's going to take people that did try vaping before, any teens that did it and that enjoyed that habit, right? And however the heck they got it, and then they're going to end up going to cigarettes. And it's going to take smokers that were, you know, had switched over to vaping. And I know that they like to say that nicotine addiction is nicotine addiction, but at the end of the day, I'm not smoking, right? So, and vaping is orders of magnitude less harmful than smoking.
And let me ask you one last question with regard to politics. We're staring down what's likely going to be a federal election. How is it that the election and, say, advocacy with that make a difference?
Well, I mean, unfortunately, you know, Health Canada has the authority to do what they want. They gave that to themselves in Bill S5. So, I mean, really, at the end of the day, the hope we have is that, you know, so we have some politicians around that still have enough of a backbone to really stand up for what's right, you know, and then squash it. Just say, you know, Health Canada, stop it. Just leave it alone. Give it a few more years. Stop working on evidence that was, you know, not only, you know, wrong, it was proven to be wrong, but, you know, give it a few years to let things, see how things go. Start standing behind it. Health Canada is meant to be an authority, just like Public Health England was an authority, right? You don't hear Health Canada being an authority about this. What you hear them doing is you hear them deferring authority. You hear them deferring it to the World Health Organization, or they defer to the Heart and Lung Association. They defer it to this. Well, you know, you're not there to defer it. If I wanted someone to defer something, I would hire a corporate, you know, business person or whatever. But you were hiring doctors there, right? So they need to really get their act together, because there's just too much that we know we will lose because of it, for fear of what we think we might lose on the other side.
And that is, you know, your lips to God's ears, as they say.
I like that deferred. I really, really like that way he positioned it. Health Canada defers to who? Health Canada defers to heart and stroke. It's interesting. Health Canada is deferring to a lot of Bloomberg money. Health Canada is deferring to a lot of pharmaceutical money.
So let me say,
very well
go
put.
ahead.
Yeah, that's a way to go, Luke. Like, I bow down to you. I love it.
Maria, you always go that extra mile.
Well, of course I'm going to go to that extra mile, because you know what? You got to treat people the way you want to be treated.
So let me throw a question out then from that exact point, and get all three of you actually to give a comment on it. We'll start with you, Shai. And that's this observation that RegWatch has based on our coverage. Just recently, we did, you know, a series of pieces on Bloomberg, you know, a special series on Bloomberg. And what came out of that coverage was a clear understanding of what the Bloomberg organizations are doing. And they're going out to low and middle income countries, and they're saying, you are so unsophisticated. You have so little resources. You can't possibly manage a legal vaping market. So the only recourse for you to do is to just basically bring flavor bans in, you know, whatever combination, to ban vaping in your country, and we'll dump some money on you and a bunch of resources. And it seems to me that in some manner or another, that same message has reached Health Canada. You don't have the resources, which we know they don't. They've outright said they don't have resources for compliance, enforcement, and all that kind of stuff. And obviously, Health Canada is very unsophisticated. Otherwise, they wouldn't have made a monumental mistake, such as legalizing vaping, and then 3 years later, gutting the regulations. Shai?
Yeah, I don't disagree with that. And even when they legalized vaping in 2016, it seems like they were listening to the lobbyists from Juul and Big Tobacco to do so. That's why they introduced a 65 milligram per milliliter nicotine cap, which, as all vapors knew back then. Back then, people vaped at most 24 milligrams per milliliter. So they introduced this issue, and now they're trying to regulate this issue for something that they made a mistake on without giving anything else a chance. They already made a mistake without listening to the industry, and now they're doubling down and they're making further mistakes by only listening to the Big Tobacco lobbyists or the body part organization lobbyists who have a vested interest to remove these products from market. There's no other way about it. There's no way that Health Canada could be willfully so ignorant and misinformed. They have to be listening to somebody that is feeding them this information. Unfortunately for our industry, they're listening to the wrong people that are giving them bad information.
Shai, I've been listening to multiple somebodies. I think they're getting the same message from a lot of big money. And that's the way I see it.
It's funded by Bloomberg or it's funded by the pharmaceutical company.
Like you're looking Big Pharma, Big Tobacco, Big Bloomberg, it's all funded there. And at the end of the day, all three of them, and let's be honest, they're not about the end user. They're not about the human, because if it was, they would start referring to vaping. They wouldn't use the term vaping. They'd use vapors. But they're systemic. They are creatively and purposefully making it sound like an industry instead of a person. So they're taking the person away. And exactly. I just want to point this out because I saw this today. I don't know of any single vaping company in the world that has hired a 13-year-old model to promote their product. But tobacco control and all these anti-vaping groups continuously hire young children to hold a vape product and smize into the camera and, promote anti-vaping. But it looks more like, vaping is cool. What do you guys think about, like, when you see those ads? Like, we are so heavily restricted on what we can advertise. And then all of a sudden you see a kid with a vape product. And Health Canada does nothing about that.
Yeah, this is totally horrible. I mean, I have two young kids. They're going to turn 6 and 8. And from an early age, they come around here and they walk into the warehouse and they know that our work is to try to help people quit smoking. Like their Uncle Jill, who is still a dual user, but he's trying to quit. And they know that's what we do. And then they see these things on TV. And I was actually disappointed way back when they removed the poison logo from the front of the bottle. Because I taught my kids, you see this, you don't touch it. Now it's not there anymore. But, we've told them this is not a product. It's to help people get off cigarette. And then they see that on TV. And I'm not sure they're connecting the dots. They're a little confused as to, well, why is this kid vaping? And I mean, it's really, really horrible. It's totally counterproductive as to what they're trying to do.
And David, so when we spoke, you walked us through a little bit in our pre-interview the saveflavors.ca. Could you do that for our viewers right now? What is saveflavors.ca and what is it that they should be doing if they go to the site?
So basically during the, we live in a democracy, or supposed to be. So before they put laws or new regulation in place, they consult Canadians. So every Canadian citizen, and Maria just said that if you don't live in Canada, you could do it as well. You're allowed to voice your opinion on the new regulation. So saveflavors.ca is a way for people to basically write up their opinion on the submitted regulation of banning flavors. So there's two ways to do it. We highly recommend the green section, which is the recommended section. What happened last time we were actively sending submission to Health Canada is they used 24,000 postcards, which were handwritten by vapors. They lumped them into one submission. So I think totally they got 24,255 submission. Well, they consider them as one, so they got 256 submission. So 24,000 people at the weight of one, just because they
David,
didn't write full sentences.
Let me just interject something. However, for the nicotine cap, they use those submissions as individuals to support the nicotine cap. So regardless of how you feel about the nicotine cap, the way Health Canada took advantage of a powerful consumer end user, that they took advantage of, okay, so these postcards are supporting our nicotine cap. So this is what we're going to put in the wreath. And oh, wait a second, these postcards tell us that only 1% of Canadians want a flavor ban. Well, let's just take them out because they don't support it. I feel like used and abused.
No.
Sorry,
so if you visit safeflavors.ca, there's two options. The first option here, you fill in your name, email, zip code, and age, and basically there's a few questions that you basically share your story. Those questions are kind of like to guide you as to what you should be writing, and you tell your story in full sentences. And it's going to create a complete submission that will then be sent to Health Canada, as well as your local MP and party leaders. So it's available to be filled up by non-smokers, non-vapers, and vapers, and that's it. The other way to do it is more simplified, but the downside of this is we take the risk of them lumping them one into one submission again. So hopefully this time we kind of know their tricks and we've figured out a way to counter them.
So then from what I understand, this particular website hopefully should get us around this issue of them, clumping all the submissions together into one.
I'm knocking on wood. I mean, they're, to be honest, I as much as I'm saying earlier, I was saying, well, I kind of have faith that there's somebody in there, but at the same time, they've shown that they cannot be trusted. So it's a very difficult feeling to wrestle with. But hopefully,
David?
I mean, right now, this has been up for a week. We've sent close to 1,500 submissions. And we have to weigh, I mean, if you think about it, on the last round, they got 255, some of which were academics that were pro-vaping. Some of them were the body part organization. Some of them were people like me. So, but they didn't, in the end, it must have been a 50-50 split, I would think. And they didn't consider it. So I can't say that our hopes are super high, but it's worth taking a shot, and we're throwing everything at them. And like you said earlier, and we should talk about this, is the election. There's people that might lose their job over this. So they have to start listening, because when you think about how many call to action generated 100,000 emails in Canada in a 2.5-3 month span, I bet you there aren't that many. Vapers are passionate people, and I believe they're single issue voter in this case.
Now that is interesting. We vape, we vote only works if people actually vote based on the vape.
David,
I know I would.
Maria?
David, can you talk about the people who created this? I was kind of in the background and watching you guys work on this. I think we need to give out shout outs to two very important people. So I'm going to give the credit. I'm going to give that task to you.
Yeah, I mean, the whole concept of prompting kind of questions and came from the spokesperson from CDVQ, Droit des Vapoteurs du Québec, Christina Exidus. So she put the whole layout together, and then we hit a wall because we didn't know how to put it together. I mean, it was a great idea, but how do you actually achieve it on programming standpoint. So Derek, I'm Derek Young, but I'm like holding back because I know he doesn't want to. He doesn't like to be in the spotlight, but he's put tremendous work into this.
Yeah, it's a really easy tool to use. If you were going to tell people if they were kind of on the fence between the two, which one should they use? Which
the
tool?
recommended.
The recommended one for the customized version.
Yeah, 100%. I mean, the other one will take you a minute. The other one, I mean, you could spend an hour on it, or you could spend 5 minutes on it, but at least there's a better chance of it being fully custom and Health Canada taking it seriously. And the more we have, the more submissions we have, I don't know if Health Canada is listening, but I would assume they're not hiring people to go through submissions. So as many people as they have now is as many as they're going to have. So I hope you guys are ready. Get your coffees and enjoy the ride.
Start reading and tracking. There's going to be a test after.
So let's hop over to Shai for a minute. Just in regards to the election, I'd like to hear his thoughts on what's going to happen. Like, is there a real fight to be had here, and any kind of advice on what to do?
Absolutely. I'm a single issue voter myself. I voted for the party that promised us the most favorable regulations last time. They haven't kept their promise thus far. I'm not going to be voting for them again.
Sorry, you're not going to be voting for them again?
No, definitely not.
So how hard is it going to be then? Because there's really only one other party that's, in a majority kind of position, and that is the Conservatives. I mean, is there a hope to bring them on board, or is that just a pipe dream?
Well, I guess your best friend is the one that you don't know, because we know with the current government, they're not listening to us. They're not responding to our questions. They're not responding to our issues. They're not responding to us as an industry. There's hope to be had that if something like that causes them to lose their position, then the opposition would obviously come in a little more on their toes to our issues.
Very interesting.
I think the problem is right now, when you're looking at a federal election, you're going to have to look at an individual basis in your riding. Other than the Liberals, the NDP and the Conservatives have not come out either way. And that's even scarier, right? The devil you know versus the devil you don't know. Yeah. Like, I'm not telling anybody how to vote. Like, please, I just want everyone to know that is your choice. What I'm saying is it's time to push your candidate when the election drops and ask them, because those two parties have not come out with a public position. And I think, Shai, you were part of the We Vape, We Vote movement in Ontario, right?
In Washington, you mean? Like in the
No,
States?
in Ontario with I Vape, I Vote, Doug Ford.
Oh, yeah, I remember that, yeah.
It's like we did that first in 2017, and, we pushed and we pushed. Do you think we can recreate that on a federal level?
I think so. I think a lot of vapors are fed up, and the most important issue for them is the fact that they are at risk of not staying smoke-free because of government regulations. So for these people, yeah, it's a big enough issue to possibly sway a vote in one direction or another.
Yeah, because I think what people don't realize and what politicians don't realize is we're not voting for vaping. We're voting for our life. And they haven't figured out how to equate that. Like, it's not vaping, it's my life, my quality of life.
Yep. If you're allowed to smoke, you should be allowed to vape.
That's right. That's essentially it. David, you excuse me. So we're just going to talk a little bit about two things that Maria's got going on with Rights for Vapors, and then I'm going to do one last round of thoughts from all of you guys and last comments. So, Maria, why don't you just fill us in about the two things that are going on? One is, of course, coming up in 2 days, and that's Dr. John Oyston, and then after that, the tour.
Okay, so first of all, David can talk on the tour too, because we're joining teams with CDVQ. First of all, we have Dr. John Oyston. The last conference that we had, that conference a couple of weeks ago, which we had over 50 people participate, which was great. We walked through the submission process. You all met Christina. She showed us how to do a submission. It went so wonderfully. I've asked Dr. John Oyston to come in. Dr. John has really delved deep into the regulatory impact analysis statement. If you go on his Twitter feed, Quit by Vaping, you're going to see the breakdown. But he's going to explain where the fallacies, or I guess the loose floorboards, are in the Health Canada position. He's going to dissect it. I can tell you that a lot of people outside of our industry will be paying attention, and they've signed up. I've just noticed names from doctors from different parts of the world that have registered. I've noticed a few policymakers. So it will be a good opportunity if they do show up, but also to have an opportunity to ask the question. Just remember, it's going to be a Q&A at the end. The more we know, the better our submission can be. I don't want to pause anybody from sending their submission sent, but if you haven't sent your submission yet, talk with Dr. John, listen to what he has to say, ask him the questions. We're open to any questions that have to deal with consumer. We are focusing this completely on the consumer.
And this is July 29th, Thursday at 7 p.m. Eastern time, correct?
Yeah. Absolutely. Okay. And we have a link. I'll figure out how to get the link onto the chat down there on YouTube.
Okay.
And then the second thing is the Vape Tour 2021, Tournée de la Vape. It is a completely bilingual tour. We have a wonderful RV that's getting wrapped. Just in case just asking anybody, if you want your face on the side of a bus, if that has been your dream, well, let me tell you, vaping can make that dream happen. If you can send us your photo, we want to have a wide variety of faces on the bus. I can't promise that your face will be used. That is all up to people who decide. It's not a contest. You can't win anything other than getting your face on the side of a bus. We are going to hit 29 swing ridings in the provinces of Quebec and Ontario. We are going to record all this. You can follow us on our different Twitter handles, Rights for Vapors. David, what is the CDVQ? Is it CDVQ4 on Twitter?
I believe so. Let me just...
Okay, yeah, I think it's CDVQ4. Here are all the ridings that we're going to. It's really eclectic. The Quebec portion will be done in French. Christina from CDVQ will be joining us. We have a bus. We're going to have opportunities for testimonials. The other big thing, and this is not completely finalized, but there will be opportunities to watch You Don't Know Nicotine. We're working on creating some viewings in different spots across the country. And we need people to show up. Here's the thing. Someone asked, what can I do? Show up. If you can get to the vape shop on on the tours, that would be great. Just show up. The more they hear from us, the more they will pay attention. What else are we doing? August 20th, we're launching it with a small demonstration in front of the CBC building. I'm really tired of that vape sale. It'll be in Spark Street. And we are just finalizing a larger demonstration in Ottawa. We are going to avoid the Parliament because they do have COVID restrictions and they do have vaping restrictions. And the fines for vaping on federal property are quite high. And I don't want someone going home owing money. Seriously, you should be spending your money on vape gear, not on because you vaped on Parliament. So we are going to adjust that. We are working together with CDVQ. This is a team event. We are looking, if you own a shop in one of those areas, reach out to us. We're trying to build this out to make it a true, our goal is to make it feel of what the vaping world is. We want them to see the camaraderie. See, David, I'm English and I can't say it.
Camaraderie.
Camaraderie. Yeah, I know that one.
Yeah. It's the Greek in me. We want people to understand that we're more than we are fighting for our lives. And the best way to do that is show people. We will have some town halls, fingers crossed that candidates, if the writ gets dropped, so that means the announcement of the election on August 16th, we are in a more powerful position to have people come out, to have an opportunity. We're trying to create this. We need to make noise. And honestly, I just want to say this. I'm celebrating my 49th birthday in Sherbrooke, Quebec.
Party.
Like, this is how committed I am to the commitments that I've made to vaping. Is I'm celebrating it in Sherbrooke, Quebec, without
Sherbrooke's
my husband.
great. Sherbrooke's great. You'll love it.
Okay, well, y'all can come out and let's have a birthday party. All I want is a cupcake and a candle, not 49 candles. One candle is enough. So, follow us at Rates for Vapors and go to our website, ratesforvapors.com, sign up for the newsletter. You'll get informed. And hopefully, if it works out, we'll be doing some live updates here with RegWatch whenever the timing works. But we will be uploading vlogs every day. And we are really trying to get that engagement both on the ground and in the cyber world. I think that's all we have right now that we're doing.
Well, it's great, Maria. Well, it's lots. And thank you for that. So, David, last word to you then?
Last word, I guess, saveflavors.ca and MPs, Liberal, we're coming for you. We're not going to let Health Canada put policies that will kill people. This is unconstitutional. I'm reading it again. It's just not right. Let's just put it this way. We've sent 100,000 letters. That's not enough. Well, there's a tour bus coming your way, and we're turning it up. The pressure is on. We're going into an election. Well, get ready because we're not going down without a fight. And if we lose that fight, we're taking the legal route, and it's not going to be pretty. So that's my final word.
Excellent, David. Thank you. Shai.
To add to what David said, are you guys familiar with Michelle Rempel-Garner, the conservative party critic?
Yeah.
She is very supportive of vaping, apparently. So I'm just going to leave it with that. And I do want to say that... Sorry, go ahead.
That's okay. No, sorry. I was talking to myself. Sorry. I thought I was on mute.
Okay. So I do want to say that not everything Health Canada has done is amiss. Like I said, I'm a proponent of the nicotine cap. I think that will bring positive change to the industry. But 4 out of 5 things are amiss, and that's a problem. And they need to speak to people that are informed about the topic and put people in charge that are also informed, so people that aren't informed don't create bad regulations. So with that, I will support what David said 100%. And if they do decide that they're going to have somebody that is uninformed creating regulations, then they're going to have a fight on their hands.
Well, that's excellent. Well, thanks, Shai and Maria. Thank you, David. Thank you. And Luke over on the other side of the screen there. Thank you very much for coming on today. I'm going to put this together likely tomorrow. It's not just a cleanup. I'm also going to do a little pass through to find some of the real golden sound bites from you all that will work as some short pieces that will also push out to Health Canada. So I'm just going to be a little bit deliberate on the release on this. And for everybody else, just to know, I'm actually going to be on vacation for about 10 days, starting next weekend of this week, really. That happens. And we're going to be releasing a series, our Whole Truth video series, which are short videos around 2 minutes long from the last couple of years. We have about 30 of them dealing with the so-called teen vaping epidemic in the Valley and a bunch of stuff around the science and so forth, and the efficacy of vaping products. And we've rebranded those as a Whole Truth message for Health Canada. There'll be 3 of them released every day while I'm gone, all on Twitter and Facebook with hashtags going to Health Canada and a couple of the body part orgs. So if you do happen to see those, please do forward them, retweet them, do all the stuff and magic with them, because for about 10 days, we're going to be banging them over the head with some really good content.
That's fantastic. Thank you, Brent, for and Maria for having us and organizing this. The work you guys put in is tremendous for Canadians in general, and I don't think
so
people
sweet.
realize
Thank you.
the fight that we're putting and the fight that you guys are putting, how important it is for generations.
Thank you.
Absolutely. I echo that statement.
Did you
And
get
just
choked up?
sorry, what was that?
Did you get choked up?
I got choked up. Yes, I did.
Oh my.
And also, too, as well, it's really important now. People have been seeing this, and I don't have it up in this broadcast, but I will during the edit. Again, we have 3 supporters from our Last Stand coverage that we'll be getting, throughout this episode. But it's been great. There was a group of about 30 or so businesses that really stepped up a couple of months ago to help fund our Last Stand coverage. And so I can't thank them all, but of course you've been seeing them over the course of the coverage, and we'll be doing something special with regards to that a little bit later on as soon as I'm back and we get into the election. So thank you very much, everybody, for coming on. I'm Brent Stafford, and this has been, in partnership with Rights for Vapors, the Last Stand Special.